Hello, my name is Trina Geye, and I am here to provide you with an overview of the SCoRes project. That is a SETBP1 community research project that we are conducting in conjunction with the SETBP1 Society. Here's a little overview of our team. I am an associate professor at Tarleton State University, as is my co-PI here at Tarleton, Stephanie Robertson. And our community partner is Haley Euler, who is the president and founder of the SETBP1 Society. So we are conducting what is called a community-based participatory research project. And there are 9 major principles. I don't want to belabor and read through all of these, but the ones to really draw attention to are that the community is the unit of identity in CBPR, which means that our link to the SETBP1-HD community via the society and Haley's leadership is critical. There is collaboration throughout the entire research project. You'll notice that Haley here is listed as a community partner, and she is co-PI. So she has the same valence of voice in the study that we do. We build on the community strengths to foster learning and capacity building. One thing that we've been really fortunate in our partnership with SETBP1 Society is how robust their connection with one another already is, and their network across the globe to provide services, and not services, but sources of information to the SETBP1 Society. So we're able to really leverage those existing relationships in that network. We value one another's skills and information. Obviously, the parents within the community are the experts on their kids, and this model gives them an opportunity to bring that knowledge to the research table. This is a long-term process. We've been engaged in this for several years, and we are setting the groundwork for sustainability. For example, one of the papers that we're working on currently has Haley as the first author, which means that she'll be the communicating author, so that if those of us who are academicians move on and do different things in our work, then that connection will still retain the link to the community. So we're really proud of that. The research process is cyclical and iterative. I will talk more about that later on, and you'll see that. But basically, we take the results from each step to inform what we're going to do on the next step. And you can see that as I kind of walk you through what we've been working on. We recognize the various types of influences on development and outcomes. There is a balance between research knowledge and social change action. So we are definitely interested in expanding our understanding of the phenotype and our understanding of the needs of the rare disease community, specifically SETBP1-HD. But we do also want the results of our research to be impactful for the community and to ultimately benefit the families that we're partnering with, and their quality of lives and the health of their children. And we want to disseminate knowledge in ways that are useful and meaningful to partners. So while we as academicians need to, of course, publish articles in peer-reviewed journals and those kinds of things, that is not the most accessible or useful platform of information for our community partners. So we are always striving to improve our communication there. So I'm going to walk you through just kind of the beginning of this. We started several years ago with the parental stress survey. And I know that some of you may have heard this information before, but I think it's important to kind of see where we've been as we progress through this study. So the parent stress survey we administered a few years ago. And one thing that was really interesting is that we did not find any significant differences between our community parents and the control parents, which is very odd. As one of the first things when we started this partnership that the SETBP1-HD community was interested in was exploring this idea of stress around parenting kids that have special needs, and kind of the whole experience of getting a genetic diagnosis and that kind of stuff is very trying on a family, right? So we were really very surprised that we did not see this. So this will bubble up a little bit later when we talk about needs, but our kind of working hypothesis here is that the baseline level of stress for the families of kids who have special needs is probably elevated overall. So if someone in this moment is assessing how stressed out they are, compared to normal, there's not going to be that much of a difference. So the overall baseline we think is going to be elevated. So that's what's going to be important later on, to identify exactly where the pressure points are and see if we can start to identify those behavioral signals of stress rather than just asking for people to evaluate their own level of stress. As another piece of this survey, we also looked at the parenting sense of competence, and there weren't any differences on the satisfaction subscale. There are two subscales for this, satisfaction and the competency. So our community parents were just as satisfied with their parenting experience as our non-community parents, but they did experience lower levels of competence. So they felt like they didn't have maybe the skills or the resources or the ability to parent in the way that they wanted to. So again, as we move through the needs survey, we're going to be looking specifically at where those competencies are that we want to move the needle on. And we also looked at the dialectical behavioral therapy ways of coping checklist. And it was really interesting to see that our community parents were much less likely to use maladaptive or ineffective coping strategies that actually don't help reduce stress and can create problematic dynamics within the family. So it's interesting here because when reporting the ways that they deal with stress, they reported more positive, effective coping strategies, but did not feel efficacious. So it seems like perhaps there's a disconnect in maybe how well the community parents actually are doing versus how well they may think that they're doing. So that's a really interesting outcome. And having met several of the parents, I think that they're probably doing a better job than they think they are. And that's what we'll find out later. So here are our parents in the SETBP1 community underestimating their stress levels, and in what specific areas do parents in the community feel less competent than their non-community peers. So those are the things that we're going to carry forward from this phase of the study. On the tail end of that stress survey, we went up to the Simon Searchlight Family and Research Conference last August, and were able to meet several of the families. We administered a KBIT for 5 participants and then a CONI for 1, and you can see the scores here. One of the things that was really interesting for us when we were looking at these scores is that the verbal score on the KBIT was actually higher than the nonverbal score, which does not align with our expectations due to our conversations with the families and the community stating that there were concerns about speech and language. And also, as an autism adjacent type disease, this is odd to see that the verbal communication was not a concern according to the KBIT. So that's something that we'll continue to flesh out and examine as we progress through this. We also conducted parent interviews as a part of that process, and that was in preparation for our parental needs assessment survey. And we recognized that there was a need for a measure of executive function that was missing from our pool of data, and also a cognitive measure for the participants whose results were uninterpretable. So some of the folks who wanted to participate were unable to participate because the measures that we had with us at the conference were not going to be accessible for them. So we needed to address that, which we are, and you'll see that just shortly. Okay, so this parental needs survey, we have already administered it. We are still combing through the data. It's a whole lot of stuff, and we would be happy to talk with you more in detail about that if you're interested. But we adapted this from the work of Pelensov, 2016. He was kind enough to share his survey materials with us, and we were able to adapt those to meet the needs of our community instead of starting from scratch. So we very much appreciate that. We looked at the following categories: equity in care, practical care needs, about relationships, emotional state, and then a summary of needs. We are unable within the scope of this brief presentation to talk about these exhaustively, but I did want to highlight a few that are kind of rising to the top and will likely lead some of our immediate next steps. So we found that lowest scores on level of support from government services. So our families were not perceiving a sense of support from government agencies and healthcare organizations and things like that. So we need to look a little bit more deeply into exactly what kinds of services our community members are accessing and at what level to see if there are, in fact, some discrepancies there. There was a lower level of perceived support compared to parents in other disease communities. And honestly, I'm kind of not surprised to see this because I think that SETBP1-HD is still such a new and relatively less understood rare disease that I think a lot of the diseases that have been around for a long time and kind of have a larger, more robust community and have a body of research, it probably does feel like there's more of a community identity and then therefore more of a cohesive level of support in these other communities. So I think as we kind of move into looking at how these different needs are met in other communities, that we may be able to kind of patch that together and increase that perceived level of support. There was also a very low score on the frequency of contact with parents who have children with a similar disease. And I really wanted to highlight that here because I know that one of the things we're doing through these conversations is to highlight the importance and the feasibility of getting these community members together to have conversations and to have their kids meet each other and to spend together some time as families. So I think that that's really important as we move forward in planning for future conferences. 15 of the 18 participants we had on this parental needs survey reported that the diagnosis had impacted their relationship with partners. We have some qualitative data to support this, so I will say that some of those impacted relationships were impacted positively and some negatively, but I really just wanted to draw attention here that there is a consistent thread that the diagnosis and the experience of parenting a child with SETBP1-HD does change the dynamics of the family, right? Whether for good or bad, it is a difference. And then 8 of 18, so almost half, reported that doctors have told them that they have depression or anxiety since the birth of their child with SETBP1-HD. And we do have some more fine-grained information. Some of those folks were experiencing depression and anxiety beforehand, but that is still a significant chunk of our community where there are some experiences of depression or anxiety, whether that is pre-existing or not. It's the reality. And then paired with that impact on relationships with partners, it is something that we want to further explore with our families and kind of what resources or supports they may need in working through those things. This survey is being communicated in bite-sized chunks currently to the SETBP1 Society webpage. We're creating infographics and then releasing those, and this is their closed webpage. So those of us who are on the research team and not members of the community don't have access to it. So Haley's linking us up with those, and the things that kind of resonate with the community or rise to the level that it seems like that needs to be addressed next will be those that are the focus of a future step. So stay tuned. We're excited to kind of see what the community tells us they want to come from this. And then phase 3, we kind of landed on calling this phase 3. I'm not really sure how or why, but that's what we're calling this. So as a follow-up to our family conference data collection, where we found that we needed some more variety in the type of information that we were gathering and also some more accessible options, we've selected the following 4 assessments. And we're conducting a joint webinar next week, actually, with the SETBP1-HD Society and inviting the families who have been members of our previous studies and who want to join at this point to walk them through what this process will look like, because I'm not sure if you've administered assessments from these different platforms. It can be a little bit confusing because you're getting emails from different places and have different requirements for logins and things like that. So we're going to show some screenshots and just really walk the families through what their expectations are, what kind of information they should be expecting to see whenever they do enroll, and that kind of thing, and hoping that we can build some rapport, continue to build some increasing rapport with the community so that they feel comfortable in reaching out with us with questions. So the idea is that these are going to fill those gaps that we identified and give us some more information on executive functioning, to give us some more information on the cognitive phenotype of the folks who weren't able to participate in what we administered in Baltimore. And we're excited because these can be administered remotely, right? For better or worse, as much as we'd love to get everybody in a room together and do assessments all day, that's not going to be feasible with the geography of our community. So we are going to focus on things that can be administered remotely. So really want to thank the Simon Searchlight team, our student research team. I don't have them listed here individually because we kind of have a revolving door as people graduate and move on to do awesome things. But we have a great crop of students that have helped with every aspect of this study. And really especially want to thank the SETBP1-HD community, the SETBP1 Society, and Haley for welcoming us into your community and trusting us with information about your kids. And we look forward to continuing this partnership and seeing what kinds of resources we can develop. So I hope that if you have any questions, you'll feel free to reach out to myself, Trina, or to Stephanie Robertson, or to Haley Euler. Thank you for your time.